Okay. Yeah. So I think a lot of familiar people in the webinar, but I would still introduce myself. So I am Srishti Khara, teaching assistant at the Department of Behavioral Health Sciences, SIHS. So I think today's webinar is one of the most significant one where we will be talking about our masters. So we had already conducted one webinar about how the master's program is going to be, which was conducted by Dr. Shrikant, who is assistant professor at our department. And I will be talking about the specializations that are offered. So everyone will have a quite good clarity of why we have chosen the specializations, how can you go about it, what is the demand in the field and everything, right? So I will quickly share my screen. Just a second. Okay, can someone quickly confirm, is my screen visible?
Yes.
Okay, so yeah. Okay, so today's topic obviously is health and counseling psychology, which are the two specializations offered in M.Sc Behavioral Health Sciences. So along with this, give me a moment. Yeah. Hmm. So firstly, I think it is very important for everyone to understand what are we offering right now. Okay. So when we talk about MSc in Behavioral Health Sciences, we are going to start our admissions soon. So just a second, I'm not being able to shift the slide. Yeah. Okay. So let's first talk about everything about MSc Behavioral Health Sciences, an overview about it. But I think that has already been covered. But for the new faces, maybe this is something that we should be at least familiar about. So everyone knows that we already run BSc Behavioral Health Sciences. We are now going to launch MSc in Behavioral Health Sciences, which are going to offer specialization to students. Okay. So duration about that, it is a 2 years full-time program, which will focus on all aspects, be it your clinical exposure, research opportunities, and the focus areas, obviously, we will talk about. As far as the eligibility is concerned, anyone who has bachelor's in mental health, psychology, or any equivalent degree with a minimum 50% marks from a recognized university would be a great fit for the program. Okay. So also 45% leverage is given to scheduled caste and scheduled tribe students. Along with that, as I've already told, that it is a 2 years full-time program, which is designed obviously to make you future ready so that once you are outside in the market, you would be readily practicing as behavioral therapists or some other designation. But I think before this, it's very crucial to understand why have we chosen BSc Behavioral Health Sciences instead of keeping it as BSc Mental Health. A quick check. Am I audible right now? I am, right? Can quickly just
Yes,
someone
ma'am.
unmute? Okay, great. Thank you. So everyone, not everyone, but most of the people who are present in the webinar already know that we were called as BSc in Mental Health, right? But we have changed it to BSc Behavioral Health Sciences due to the NCHP Act 2021, which says that behavioral health is the preferred term over mental health. That is why we have changed the nomenclature. And when we say this, behavioral health sciences, after your master's, you would be called as behavioral therapists, and you'll get a formal and official license to practice that. Up till I think till date, only clinical psychologists had a licensure under RCI, Rehabilitation Council of India. But now we have a provision for us to get registered, and we need not do MPhil or become clinical psychologists only. So that licensure is given. So BSc Behavioral Health Sciences, if someone has graduated, would be called as behavioral analysts, wherein MSc Behavioral Health Sciences graduates would be called as behavioral therapists. That's the difference. So we are coming under the guidelines of NCHP Act 2021. Okay. So again, getting back to the eligibility, as I already told, bachelor's in mental health, psychology, or any equivalent degree, 50% marks from a recognized university. Duration is obviously 2 years full time. And obviously, even the bachelor's and master's curriculum is NEP aligned. Now, multidisciplinary approach in psychology, where you get to learn not just psychology, but you get to develop your own personality. You get to learn subjects from HR point of view. You get to learn and practice your skill set from how do you call it, a personality development point of view, where you get to learn basics of language, where you get to learn creative writing, where you get to learn about your culture. So it's just not about psychology. It is about, or we call it behavioral sciences, but how would a collaboration and blend of all these fields would do? Now, when we talk about approach blending in multidisciplinary, which could be under the domains that are available in behavioral sciences, you get to learn about neuroscience, you get to learn about healthcare setup as a whole, you get to learn about public health as well. So I think in the later slides, I can show you the program structure, which I've already scheduled, and we can get a hang of what all you can get to, what all courses you get to learn in your masters. Okay. Obviously, when we talk about the focus area, it covers mental health, conditions such as depression, anxiety, schizophrenia, addiction, coping strategies. So, rehabilitation is also a good option for the students who are opting for masters in our department, because we just don't cover the clinical conditions. Along with that, skill set is required as well. Coping, therapeutic design, how it is to be made, how to blend psychometric and research is also taught. So focus areas will cover blend of everything that is necessary for you to become market ready in those 2 years. Okay. And when we talk about clinical exposure, some of the students who are in the webinar already familiar with SUHRC hospital setup, which is our Symbiosis University Hospital and Research Center. And it obviously includes 900 bedded hospital with internships, clinical postings, which readily our bachelor students have experienced and have been a part of. Field visits, which a lot of people are familiar. Field visits being to Child Learning Development Center in Pune, then Muktangan, then it would be Manashakti Mind Gym for hands-on experience, as well as some in-house facilities we have. Students have access to the cadaver lab they went, so they could see the organs, the human organs in person. So clinical exposure from that perspective. When we talk about research opportunities, a lot of students are already engaged in research, but in masters, we have got supervised projects along with other benefits, wherein we could also consider national and international collaborations. And it will be obviously a procured process, where I think some of the people are already familiar with the IEC and IRC Council. So great research opportunities. Coming to the career paths, obviously that is something we would be looking into later. But graduates from M.Sc could obviously work in healthcare, community organization, private practice is one thing which is possible after masters rather than bachelors, and research roles could be junior research assistants, could be research coordinators. Along with this, you can also work in organizational setup where you can work under the HR community, where your main focus would be not particularly diagnosing, but personality testing, aptitude, IQ, which is also covered in your psychometrics. Now, coming to the last part of this, the admission timeline that we talk about. So, registrations will be opening from 24th March 2025. And after the whole process of SOP submission, interview, merit list, the program will commence on September 8th. So these are the tentative timeline dates. and it is obviously subject to change, but that will be informed on the website. And this is all about your MSc in Behavioral Health Sciences, an overview of how the program is going to be, and basic admission registration details. Now, moving on to why specialization matters in today's healthcare and mental health landscape. Now, let me tell everyone, very blindly, students are just attracted to one or the other branches or subject of psychology. But the reason behind choosing specializations should be clear in everyone's mind, right? So, as moving on to the key pointers of it, we are in the healthcare industry. After COVID, the healthcare industry, specifically the industry of mental health and behavioral health sciences, I would say, has grown immensely. People are taking mental health seriously after COVID, because only and only you experience it would be a greater possibility of you focusing on that fact, which is very true. Okay. So, starting up with the key pointers, I'd say obviously there is the rapid evolution of mental health and behavioral health fields. Now, we see after COVID, there is immense boost in the demand of our field. And obviously, if there is a demand, there is a requirement of a skilled force to perform that. So, as these fields are given more importance right now, the requirement of specialized skills and professionals has increased. There are many government organizations, even private organizations in our country, which lack specialized and professional team members when it comes to the field of psychology, behavioral health, or healthcare sector from a mental health perspective. Now, obviously, rising rate of mental health disorders are seen. So it could be in any spectrum. It could be anxiety spectrum, depression, PTSD. Now, dependency, we see nowadays people are using AI too much, okay? The dependence syndrome is increasing. So these mental health concerns or mental health illnesses are not going to decrease, okay? Given the technology demand and given the lifestyle that we are in, given the stressors we are facing, be it with students, mental health professionals themselves, be it with any professional workers, it is always going to increase. Okay. So we would never see the rate falling. It is going to increase with the increasing pressure and the demands that life has on us. So making an expert intervention is always crucial for that. So specializations offer you the space to expert and make yourself more skilled in one particular area. So that for that particular area, you have your headstrong defense toolkit and you are all equipped to diagnose, treat, and help and provide therapy to such individuals who are in need. Now, healthcare systems globally are focusing on personalized care, okay, leading to the need for professionals with very specialized knowledge in areas, especially health and counseling psychology. I think everyone would agree that counseling psychology is an immense important course or subject to study, as a lot of students of ours are already practicing it in our clinical postings at the SUHRC set. So if you are already aware about counseling skills, you're getting to learn how counseling skills are administered. It will also be linked. Now we are talking about the healthcare sector as a whole to know more about how health psychology would work in that aspect, right? So that is one major reason we have kept these two specialization, counseling as well as health psychology. Also, specializations will enable professionals to focus on specific groups. Okay. Now, when I say specific groups, it could be the children, the elderly, or just the disorders. Also, I have one question for the people or the participants present over here. I would like any one of you all, or maybe few of you all, to unmute and tell me which branch or which target population would you like to work with? Like children, elderly, or just the disorders, just rehabilitation, just addiction. So, can I just have a quick interaction with you all? Anyone can answer. Yes? Am I audible, guys? Hello? I think there is a glitch. Am I audible? Can someone
Yes,
just
ma'am.
unmute?
Yes, ma'am.
Yeah. Okay, Avinash, would you like to answer what target population you would like to work with?
Ma'am, I'd like to work with children and
Okay.
especially who are from a defense background.
Okay, wow. That is great. To be very specific, yes. Anyone else? Okay, that's fine. Okay, so moving ahead, yeah. So for children setup per se, okay. Now, if you're already equipped with the knowledge that is getting you industry ready, now be it with counseling skills, under counseling you'd also learn then now that Avinash has told that he'd like to work with children, specifically defense background, right? Now that could be one filter that could be applied once you are industry ready. But knowing how to deal with a child, how to take case history with the child, how to administer counseling skills, how to administer the assessment to the child will all be taught in your counseling psychology. And health psychology would obviously focus how and when and in what aspect health uh, the health domains are affecting the children. Okay, it could be stress related, it could be vulnerability, it could be inherited. How are the disease triggering and how the sympathetic drive or the stress is impacting the health of the child. Okay, now coming to the quick benefits, obviously provides deep knowledge in specific areas leading to more effective treatment planning. So if you are carrying expertise in one particular domain, obviously that comes without a doubt that you would be very efficient in designing therapeutic plan or a treatment plan for the patient. Now, also it opens diverse career opportunities in specific sector. The one that you are interested in could be clinical, could be research, could be community, health, etc. Okay. Then it also enhances employability and job satisfaction by aligning the professional's expertise with current mental health challenges. Okay, if you're already equipped with the knowledge, so the rising demand and challenges would be very easily faced with the knowledge that you carry and the skill set that you have. Okay, so this is about why the specialization matters in today's world and why people should opt for specializations. Moving ahead. Yeah. Now let's look at our very first specialization, which is health psychology. Just a second. Okay. When we talk about health psychology, so health psychology firstly focuses on understanding the mind body connection, okay, with health and disease. Okay. So first let's look at what health psychology is. Okay, it obviously examines the relationship between mental processes and physical health. How are your mental processes affecting your physical health? And thus it studies how psychological, emotional, and social factors affect physical well-being. Okay, so obviously we are concerned with how our disease are what you could say, based on your mental health concerns or any mental processes that are going on. Could be distress, could be one factor, right? And then other mental health concern, low self-esteem could be one problem. Then again, excessive anxiety could be one. There are ample of them. Okay. So mostly it focuses on how behaviors, thoughts, and emotions influence the outcome. Outcome could be any disease that you are facing, right? So, understanding the psychological factors that impact your illness, or just not illness, along with that recovery, your overall health. It could be, for example, your stress and coping mechanism, the relationship between it could be studied. and how it is affecting your health at the end. So, how mental health can influence conditions like it also could be your heart disease, diabetes, chronic pain, right? There could be ample of things. Now, role of health psychologists in chronic illness management, right? It could be even preventive health care or your behavioral outcomes. So, when we talk about chronic illness management, health psychologists help patient manage long-term health conditions. Okay, for example, diabetes, cancer. They do this by promoting healthy behaviors, which is the end goal that is to be practiced in health psychology. Could also be for improving treatment adherence and reducing stress or any other mental health concerns that you have. So the end goal for all the knowledge base that you're gaining for health psychology is comes and narrows down to promoting healthy behaviors. Okay. Now, preventive healthcare, if we talk about encouraging healthy lifestyle choices like diet, exercise, and stress management to prevent diseases. For example, now if we talk about obesity, okay, obesity, any heart disease, any potential heart disease risk that could be there. How to prevent this? By then encouraging to the patient or clients to have a healthy lifestyle choices, be it with their own self-care routine, be it with their own balanced diet, or then physical exercises that has to be carried on a regular basis. Coming to the behavioral interventions, employing strategies like cognitive behavioral therapy to help individuals alter unhealthy habits such as smoking or excessive drinking. Now, when we talk about CBT is a very in moment therapy. You deal with the behaviors that are right now going on with you and you would like to change them. It directly targets your thought process. And with your thought process, insights are new and desirable and appropriate insights are brought into the perspective for people to understand where they are going wrong and how it could be worked upon. Now, one example for this could be helping a patient cope with the emotional toll of chronic illness. Okay. Second could be designing interventions to improve patients' adherence to prescribed medical regimens. Yes. Now, coming to the applications part, health psychologists could work in hospital settings, firstly, by supporting patients in managing stress, anxiety, and pain related to medical treatments or hospital stays. Secondly, it also could be your corporate wellness programs. As I said, you can be employed under an organization, a corporate MNC, promoting stress reduction, work life balance, and healthy life choices among employees to improve more productivity and well being. Then moving on to your public health initiatives. It could be such as contributing to programs focused on smoking reduction. It could be your weight management, vaccination awareness, and disease prevention. So, very closely, you will have to work with medical doctors as well. Because when we talk about health, it comes in a complete package, just not mental health, but your physical, physiological health is also taken into perspective, right? So, this is all about your health psychology, what it is, what it does, its scope, and applications. Moving on to the next slide, which is your counseling psychology, the second specialization that we offer. So I think counseling psychology is nothing new for everyone, but in our masters, we will be studying in more detail and you'd get a good hang of it when I show you the program structure in some time. Okay. So firstly, when we talk about counseling psychology, it plays a big role in mental health support. Okay. Therapy as well as it's included and your emotional well-being. So, counseling psychology is actually very, very useful and helpful when we talk about emotional well being, especially after COVID. This field has immensely grown to become a big umbrella term itself. Okay. Now, when we talk about what counseling psychology focuses on, it's helping individuals deal with emotional, psychological, and social issues through therapeutic techniques and support. Okay. So everyone is already aware about the ethical considerations, to be taken into perspective, consent of the client to be taken into perspective, and initially how to engage in counseling skills, right? This is what your counseling focuses on, but it's just not that. That is the initial part. The secondary part would be how would you be administering the skills and a blend of a therapeutic technique and support. So quickly moving on to the key roles here. As a counseling psychologist, you would provide therapy to individuals facing mental health conditions. It could be preliminary stages of diagnosing depressive symptoms, anxiety, talking about trauma, rediscovering the material, the unresolved conflict that is inside the head of the client. Also offer guidance on relationship issues, stress management, career challenges, and life transitions would be there, where adjustments would be taken into consideration, how to better make the individual more adjustable to the current environment. Along with that, support individuals in developing resilience and coping strategies for mental well-being as well. Okay. Now, when we talk about techniques in counseling, so there are different techniques and different approaches that are focused on. Um, so as I've already told you, CBT is one of the very in-moment therapy, right? Where you target the thought process of the individual. So that is pretty much clear about. You use journaling techniques, you use cognitive restructuring, where you try to change the thought process of an individual from an undesired to a more desired one. Now, talking about psychodynamic therapy, focuses on your unresolved conflict dating back to your childhood, and then maybe talking about the resistance that you're facing and how it could be worked upon. Okay, dream analysis is one aspect under psychodynamic therapy as well. Solution focused therapy as well. Now, here you are mostly into how to get insights into the therapy. So, out of all these, if we ask greater insights to get under what, then it will be your solution focused therapy. Okay. Now, along with that, we also use other types of counseling, clinical counseling, for example, that will include all your CBT, psychodynamic, and solution focus. It focuses on treating individuals mostly with psychological distress or mental health disorder under educational setting. These techniques support students in managing academic pressure. It could also be bullying, career decisions, along with that, your personal issues. So, use of guidance and developmental therapy to enhance student well-being is the main focus over here. Okay. Now, at the corporate counseling level, so counseling employs here for stress management, as I've already told, work-life balance, career development, and addressing the workplace mental health issues like burnout, your workplace bullying, conflict resolution, team building, right? That could be one. Now, when we come to the career opportunities as such, so what is included in the career opportunities? Obviously, private practice is one aspect which is very readily known to everyone. So people, after completing their masters, open private practices offering therapy and support to individuals. And it could be wide array you could choose, or you could just stick to one target population. Now, there are these counseling clinics where you provide therapy to individuals, and even there you could have a collaboration and tie up with other medical doctors, okay, so that you get a good flow of a clientele. Along with that, under school setup, we see school counselors who help students with academic pressures, social issues, and mental health challenges as well, right? To enhance their personal growth. And in workplaces, there is employee assistance programs that allow counselors to provide mental health support to all the employees, addressing workplace stress, conflict, and any career related challenges. So this is a brief overview about counseling psychology. I hope it is clear. Now, let's talk about interdisciplinary opportunities between health psychology and counseling psychology. Okay, why these two other specializations could also go hand in hand. Okay, so common ground when we talk about both of these fields focus on improving mental well-being and enhancing coping strategies for individuals with a shared goal of improving overall health. Now, your physiological health, your triggers, how psychological problems would affect your physical health would be taken into consideration under health psychology, and how to deal with them would be taken into consideration through counseling psychology. Okay. So, collaboration obviously is essential when managing these chronic illness, mental health disorders. It could be any stress related health conditions as well. Okay. Now, if we have to focus on examples of areas for collaboration under chronic illness management, for example, could be health psychologists and counseling psychologists collaborate to help patient cope with the psychological and emotional impact of chronic illness. It could be diabetes, for example, or it could be the early stage of cancer, for example, right? Now, moving ahead to stress and anxiety. Health psychologists may work on stress reduction techniques, while counseling psychologists may provide therapy for anxiety and mental health issues. Do you get the difference? And do you get how they are collaborating to, have a healthy impact on the individual? And along with that, behavioral health programs that we talk. So both fields are very critical in the design and implementation of behavioral health interventions, okay, which are aimed at lifestyle changes. Now, smoking cessation could be one, weight management could be one. There are ample. Okay, so hand in hand, these fields would make you well equipped with what is needed to understand, analyze, and treat the population which have very modern problems. As we say, modern problems require modern solution. Yes, it is very necessary. So that is all. That is all that's covered under your interdisciplinary opportunities between these two fields. I'm moving ahead. Now let's have a quick look under the program structure. Quickly reshare. Yes. Is the program structure visible? Can someone tell me?
Yes, ma'am.
Okay, good. So this is the program structure that we have designed. So you would be having 2 years, which are 4 semesters. So for your first year, which is semester 1 and 2, it is going to be plain. From the second year, you will get to choose your specialization, be it health psychology or counseling psychology. So let's have a quick overview and just quick look over what courses we are offering. Okay. Now, global behavioral health is one course that we offer. Okay. Then we have neurobiological foundations of behavioral health. Obviously, uh, everyone is aware brain is a very central part, and how your brain and how your central nervous system would lay a foundation in understanding behavior, understanding biopsychology is very important. Hence, this course has been designed. Then we have psychological theories and models of human behavior. So to understand the human tendencies, right, and to understand the psychology behind it, could be behind distress, behind certain illnesses. It is very important to have a good analysis and understanding of human behavior. Hence, this psychosocial domains of health, perspectives and framework. So there is this one model of SESI's bio socio-ecological model, right? So whenever you would want to diagnose a clientele, right, it is very important and immense significant to look from a holistic perspective. There could be personality dissociations, there could be psychological triggers, there could be environmental triggers, there could be something going at the familial level, right? So all of the things to be taken into perspective to properly diagnose the individual. Now, as we had already discussed about research, we have a course on research methods in behavioral sciences where you will get to learn about what research is, how it is conducted, types of research, the framework that is needed, so that you're well equipped with that knowledge. Moving on to semester 2, we have clinical psychopathology for you to understand the mental illnesses, the disorders, be it psychological or psychiatric disorders, uh, the causes, the etiology, and how to deal with this, right? Along with that, how to maybe provide a proper diagnosis. And obviously, ICD 11 and DSM is followed for this. Clinical assessment and interviewing techniques. Now that you've already had a knowledge of clinical psychopathology, how would you clinically assess the individual? How would you interview the individual? So, mental status examination or your case history taking, all of this would fall under this course in a more detailed manner so that you know how to assess the client and interview the client when the client is sitting in front of you. Now, neuroscience of behavior. How is your biology affecting your behavior? One of the most significant topic, okay? Because we're also focusing on neuropsychology. Now, health psychology is taken into consideration. Along with that, how is your neuroscience affecting your behavior? So here your complete biology will get covered, be it from your neurons, specialized cells, neurotransmitters, hormones, brain, to the nervous system as a complete whole. You've got your internship opportunities, which will be a detailed internship. Now that after you've learned this, how are you being able to apply this to the internship? So for that, we have kept one course for your internship, which is at the end of the semester too. Now moving to the specialization. Now specialization in counseling psychology, clinical practicum, obviously, everyone is already aware, I suppose. Counseling and psychotherapy techniques, areas of counseling, guidance, and career counseling. So, to quickly get you familiar with how counseling process or counseling skills work and how psychotherapy at a very preliminary stage is administered will be covered in this course. Now, how many areas of counseling exists? Which is a very big question. Nowadays, geriatric counseling is also getting too popular. People are loving to work with senior citizens. There are ample of it, just not limiting to organizational, children, and individual counseling setup. School counseling, marital counseling, family counseling, grief counseling, many other areas are into picture nowadays, and even the diverse clientele prefer specific type of counseling for their own concern. Along with that, guidance and career counseling, this is a very interesting aspect of counseling, I feel, because it's very crucial to understand how to use your expertise in counseling to guide someone in their own career. Hence we have chosen this course to be kept. Now, specialization in health psychology, clinical practicum, obviously. Now, your counseling and psychotherapeutic techniques, keeping in mind health psychology aspect. This would be, as this pointer is similar for both, there would be some different alterations you'll get to see based on the specialization that you'll get to learn in the course. Now, psychological aspects of chronic illness and disease. Everyone is already aware about the illnesses. Everyone knows at the tip of their tongue what chronic illness is. But what is the psychology lying behind it? What aspects are contributing to maintain the disease or the illness is to be learned in in this course. Now, health promotion and intervention. You remember I had already talked about the end goal of health psychology, which is promoting healthy behaviors and providing support for the same. That is something which you'll get to learn in health promotion and intervention. Okay. Now, this semester 4 in your specialization counseling, you would have a great knowledge of advanced statistics, because as we are taking psychometry into consideration, assessments are very widely used. For that, you need to have a good knowledge of advanced statistics, how to use NVO software for qualitative data, how to use SPSS for statistics. Everything will be taught. Now, research project or dissertation will be there in your last year's last semesters, and that will be obviously solely pertaining to the specialization you're choosing in and your internship in detail. Now, your internship hours would be counted in this matter. Now, semester 4 for specialization in health psychology, we have similar for this as well. Advanced statistics, research project dissertation, and internship. So this is your detailed program structure. And yeah, so these are the external credits, total credits, and your marks. So I think we can just quickly get back to the PPT. Yes. So that was your program structure. I hope you guys have a good understanding of what all courses we are offering and when you can choose your specialization. Okay. So, I think from my side, I'm done with explaining in detail why we have chosen these specializations. How are these specializations going to help you? Where can you work with these specializations, right? Along with that, as our registrations will be starting soon, 24th March, you can contact us. If you want, you can just take a screenshot or write this down, however it is feasible for you. I will keep the slide on for another 2 minutes. Also, for the students who are currently enrolled with us, for them to note that we have a different email for master's admission, which is admissions_bhs@sihs.edu.in. So kindly take this into consideration. You can note down the contact details as well. Okay. And that is all from my side. So quickly, we can have any queries that you guys have. Give me a moment.
Ma'am, am I audible?
Yeah, Zoya, tell me.
Ma'am, even if we do bachelor's for 4 years, do we have to do a 2 years master's? Ma'am, you're muted. Can't hear you.
Ma'am, we can't hear you.
Am I audible now?
Yes, ma'am.
I think there was a glitch. Can you please again repeat your question, Zoya?
Yes, ma'am. If we do a bachelor's of 4 years, do we still have to do a 2 year master's?
Yes, at our department, you will still have to do a 2 years master's because master's is all about specialization, as I've already told you. So your first year is going to be plain, which will cover basic foundation aspects of whatever you've done in your bachelor's. And then from second year of master's, you'll get your specialization. Although we also would accept applications of students who have done 3 years bachelor. Because even for our bachelor's program, after 3 years, there is one exit that we provide to students. So if you want to continue with the fourth year, you can. Otherwise, after 3 years, you would want to exit and get your degree. That is also possible. I hope I'm clear
Okay,
on that.
ma'am. Thank you.
Excuse me, ma'am.
Yes, Panika.
Ma'am, I had a question regarding health psychology.
Mm-hmm.
So, like we have studied, we studied that there are other fields like psycho-oncology, psychoneuroimmunology, pediatric psychology. So, how does it relate to health psychology basically? Since are they completely different fields, or they do come under health psychology somewhere?
So the thing is, you are talking about the fields which are actually falling under the domain of health psychology. So see, there are certain spectrum branches in psychology. I'm saying spectrum branches, जिसके अंदर सब cover होता है, right? Now you would say psycho-oncology and all of these things. A very basic understanding of health psychology is to be given. Now देखो, counseling के अंदर भी nowadays I said that people said that geriatric counseling आ गया है, clinical counseling आ गया है, but counseling is to a very umbrella spectrum under it, right? That is why we have chosen health psychology. Under these sub domains would come the ones that you've mentioned, because for that foundation of health psychology should be strong, right? तब जाके आप psycho oncology, psycho neuroimmunology ये सब पढ़ पाओगे, right? And we have basis of neuroscience and neuropsychology as well. So the blend of all this, then after this you can also, if you want, could focus on psycho oncology more, or any other upcoming branches or fields that are there.
Right.
So yeah,
Thank you, ma'am.
foundation psychology, health psychology. That,
Okay. Thank you, ma'am.
yeah. Any other questions? Okay. Also, a quick feedback if I can have, because I have quite familiar faces here. Was the webinar helpful to understand about the specialization that we are going to offer in masters? A quick feedback anyone can give. Lokya. Lokya has not spoken. If Lokya can provide a feedback. Lokya, are you there?
Yes, ma'am, I'm there.
Yeah, please offer a feedback of how did you find this webinar?
I found it really helpful. Thank you so much.
Okay, that was really quick. Okay, so the aim behind this webinar was obviously to get everyone acquainted with the specializations, okay? Because since we have taken, if you don't give it a good thought or a clear understanding is not provided, people think कि दो spectrum पे अलग specializations offer कर रहे हैं, कि health psychology कहाँ है और counseling psychology कहाँ है. So we thought to preliminarily, as a prerequisite to the program, if we clear this understanding, and if we get everyone acquainted why these specializations are into picture, would be greater, of greater help, so that there'll be no doubts and confusions if at all you want to enroll with us for masters. So this was the whole agenda behind it, and I hope that it has helped you. Along with that, do we have any more questions, by the way, at the moment?
Ma'am, is the
Avinash.
fee structure like prepared, or is it yet to
The
be?
fee structure is yet to be finalized, Avinash, but as soon as it will get finalized, it will be uploaded on the website and it will be notified as well. Is that the only question you had, Avinash?
Yes, ma'am.
Okay. So any more questions, guys? If not, I would quickly request everyone to switch on their cameras to have a screenshot of this webinar quickly over my laptop. Can we have your cameras on, guys? Okay, guys, can you please switch on your cameras? At least inform me. Yeah. Okay. Thank you so much, Panika. Lokya, Zoya, Anushka. Okay, only Zoya's left.
Ma'am, I'm trying. I'm not able to turn on the camera. Just a minute.
Yeah, it's fine. You can take your time. So, guys, one more thing to quickly inform. This webinar series is, we are not majorly concerned about the participants. Obviously, we are with the registrations, but this webinar session will also go live on the YouTube. Okay. So if you feel that you need to again rewatch this, get more knowledge and details, or share this with your friends, whoever needed, please get in touch with me or the contact details that I've given over there, and you can reshare it to as many as people you want. The webinar is not going anywhere. The recording is available with us for all the webinar that has been that have been conducted. Okay. Okay. So quickly a picture. Can I have everyone's smiling faces, please? Okay, one more. Okay. Parnika, can you also click one in case yeah. Done? Okay. Thank you so much, guys, for having me and being here. I really appreciate all the participants, especially the familiar faces. I'm so happy to see you all. Feel free to get in touch with us and wish you all the best. Thank you. You
Thank
guys
you.
may leave. Yeah, thank you.
Thank you, ma'am.
Yeah, thank you.
I leave.